Let's begin our discussion of the leukocytes, or white blood cells. First off, you'll notice that they are not white. They are fairly transparent, therefore we need to stain them. The typical stain is called the Wright stain, and each of the white blood cells will stain somewhat differently so we can distinguish them from one another. The second point I want to make is most white blood cells are not found in your blood. Only about 2% of your white blood cells are circulating in the bloodstream. They use the bloodstream to get to their final destination. The 5 major white blood cells we're going to be learning about are the neutrophils, eosinophils, basophils, lymphocytes, and monocytes. You'll notice each of them have a slightly different appearance. Their nuclei are going to look a little different, and then the presence or absence of granules. Let's begin by learning about the neutrophils. The neutrophils are the most numerous circulating white blood cells. Of all the circulating white blood cells, neutrophils make up about 60 to 70%. They're fairly large, 10 to 12 microns in diameter. If you recall, that would be bigger than the red blood cells. The granules are seen using the neutral stain that's in the Wright stain, which is purple. So the granules appear purple, but they are very, very small. So each of these neutrophils has the darker nuclei, which is often found in different lobes, and very, very small granules. So the nucleus varies in shape, 2 to 5 lobes, and the number of lobes increases with the age of the cell. They're often referred to as polymorphonuclear leukocytes, or PMNs. That's because their nuclei come in different shapes. Their major job is to help during inflammation. What they do is they will help phagocytose bacteria. They will be found to be elevated when an individual has an acute bacterial infection. And they can emigrate or undergo diapedesis. That means they can exit blood. So what might happen if you get a bacterial infection is the numbers of neutrophils will go up, and they will be able to exit the bloodstream where they can find bacteria that have invaded the body. They live for a couple days, and then they begin to die. They use things like enzymes called lysozyme that destroys bacteria. They will release hydrogen peroxide, which kills bacteria. And they release proteins called defensins, which puncture the membrane of bacteria and fungi. And then don't forget, they can also phagocytose. They can gobble up bacteria to destroy them. In their immature form, they tend to be called bands or stabs because their nucleus has not lobed up yet. It just looks like a band across the cell. And then as they mature, as they circulate, they become more segmented. Sometimes they're called segs. So for each leukocyte, I want you to pay particular attention to a few things. One, be able to identify the cell. If you see a cell with many different shapes to its nucleus, it's probably a neutrophil. Know the normal percentage and know the function of the leukocyte. The next one are the eosinophils. They're the second granular leukocyte. They are found about 2 to 4% of the circulating white blood cells. They have the size very similar to a neutrophil, 10 to 12 microns in diameter. They typically have a two-lobed nucleus. Sometimes people refer to this as looking kind of like a barbell, and that there's two swollen ends connected by a skinnier crossbar. The key designation is to be able to identify the fact that they have a reddish, brick red staining granules. This is due to a dye called eosin. In fact, they're named after the fact that they take up eosin, so they are eosin-loving cells, or eosinophils. Eosin is an acidic dye. These cells tend to take up these acidic dyes and therefore become stained. Sometimes the stain appears more red, like in this picture. Sometimes it's slightly orangish red. What's the function of eosinophils? Well, one, they are capable of diapedesis and phagocytosis as well, so they can exit the bloodstream. But what they do is they remove antigen-antibody complexes and viruses. They release cytokines and leukotrienes that augment the inflammatory response. Basically, they are found to help reduce inflammation during allergic reactions and asthma. So they do not promote the inflammation, they help reduce the inflammation. They do this by releasing an enzyme called histaminase. This is an enzyme that breaks down histamine. Histamine is a major pro-inflammatory molecule. It produces an inflammatory response. Therefore, if you make an enzyme that destroys histamine, you will reduce inflammation. One other function of an eosinophil is they are found to have been able to destroy certain parasites, like some of the parasitic worms that can infect humans. So eosinophils, as a review, be able to identify them, pay particular attention to their color. Their granules are a reddish orange. They're about 2 to 4% of the circulating white blood cells. They are found to reduce inflammation, destroy certain parasites, and they produce an enzyme called histaminase. The final granular leukocyte we will learn is the basophil. The basophil is the rarest, less than 1% on normal blood tests. They're 8 to 10 microns in diameter. Their distinct characteristic is their dark purple granules scattered throughout the cell. In fact, they make it very difficult to identify a nucleus. Inside their little granules, their little vesicles, are molecules such as histamine and heparin. Histamine promotes inflammation. So these guys will be at the sites of allergic inflammatory reactions, parasitic infections, particularly when there's an exoparasite like a tick or a flea. They secrete inflammatory mediators that promote inflammation, such as histamine. So they contribute to the local inflammatory response. In some tissues, there's a cell very similar to a basophil called a mast cell. Mast cells are resident cells, meaning they stay in a certain tissue. They don't circulate in the bloodstream. But mast cells are very similar in that they play a central role in inflammation by producing histamine and heparin. This histamine does two major functions in a tissue. It increases the permeability of blood vessels. That means things can get out of the bloodstream better if the blood vessel is more permeable. Those things include cells, like neutrophils, like macrophages, but also things such as antibodies that might help fight an infection. They also cause vasodilation to local blood vessels. That allows more blood to go to a site. So for example, when you have inflammation in the skin, it's usually red and hot. That's because there's more blood flow to that area. All major functions of histamine from basophils and mast cells. Here's a review table of the granular leukocytes we just covered. Neutrophils, eosinophils, and basophils. This would make a very good study slide. Understanding the difference in what they look like, their normal circulating percentages, and their functions. In the next video, we're going to begin our discussion of the agranular leukocytes.